But what I'd like to do now is to keep you online for a few more minutes and indulge the questions of our audience. We have a great audience here in London and also some people online. So I'd first like to maybe turn to our London colleagues to see if there are any questions that you have for our panel. And please use a microphone so that our online audience can hear as well. Anybody here have a question? And please introduce yourself when you get the mic. Thanks.
Hello. Yes, excellent. Hello, everyone. My name is Markus Geisser from the International Committee of the Red Cross here in London. I have two questions, maybe one for Marwa. With regards to your situation, again, Yemen in an armed conflict, could you allude a little bit more about the challenges that you face as a health worker when engaging with your patients? Our colleague Grace has developed a little bit on the challenges and also the challenges, if I may now say, use the term challenges of her work during the Ebola crisis and with patients. And again, of course, as a health worker, you have to show a great empathy with your patient for obvious reasons. But do you sometimes also get into, because we talk about danger to health workers, also, do you sometimes face challenges and even security problems inside your hospitals as you engage with your patients? And then a question for Len about the paralysis that you're referring to since 2016, and I suppose you're referring to the UN Security Council 2286, I think it is, and since then not much has happened, and also the commitments. Well, would you somehow think that states, and I think all the states have signed up to the Sustainable Development Goals, that this is kind of a new set of commitments that states have signed up to, that you could make a kind of a reflection that the destruction and attack against health workers, that would be SDG number 16, would actually not be beneficial for SDG, I don't remember which one exactly now, that would relate to public health. Is there a way to actually name and shame states and to refer to other commitments that they have signed up to? I know ICRC, of course, we know the commitments they've signed up to when they sign up to the Geneva Conventions, but again, let's think about the SDGs as a sort of commitments that states have taken. Thanks.
Great, thanks, Marcus. Maybe we could have one more question before I turn it back over to the panel. Yes, please go ahead.
Hi, I'm Georgia. I'm a research associate at King's College. This question is mainly directed to Lee. So before you mentioned there's always a place for good data. And when we want to collect some of this data, do you think there generally still is a lack of humanitarian research, like real-time research on the ground? And is this why we're not mainly collecting the psychosocial reports that we need of humanitarian workers? Is this just a lack of humanitarian researchers on the ground, or do we feel like frontline workers aren't trained enough to collect this type of data? Thank you.
Great. Why don't I ask our panelists to respond to those two questions. Marwa, do you want to start with Marcus's question about, I think it was about focused on patient safety as well as health worker safety. Do you want to comment on that first?
Yeah, so I mentioned something about the challenges. So the challenges that health workers have been facing, the challenges in personnel. So health workers have been a lot of challenges at work. Yeah. So
just when it's getting good. Maybe Len, in the meantime, can you perhaps turn to Marcus's question on the SDGs? Are they a help in this regard?
Well, hello, Marcus, and I also want to salute the work of the ICRC on this problem. It has done remarkable work to bring awareness and to make recommendations that are quite practical about how to solve some of these problems on the ground. And I agree that we should use every opportunity at our disposal, including the SDGs, to hold states accountable for their own commitments. The key to me, however, is to get external reports, particularly from recognized UN agencies, whether it's the Secretary General of OCHA, the High Commissioner for Human Rights, to have credible reports on what states are doing and not doing. And I think the SDGs are another handle, as well as the Security Council Resolution 2286 commitment. So yes, I think that is a good strategy. But the key is the external reporting.
Great, and maybe Lee, if I could turn to you with the question from Georgia, was it, at King's College, about the lack of research on the ground but the lack of ability perhaps to collect the right data.
Sure, and I suspect that Len would offer you a much more informed answer than I can. Safe to say that it is our responsibility, of course, to share the data that we have and the testimonies that we collect. I'm pledging to call Len after this meeting to share those things with him. But perhaps we should give the floor to Len to answer that specifically.
Len, do you have any thoughts on that question of research and data collection?
Data collection has been a key problem in this area, and that's why 5 years ago the World Health Assembly mandated the World Health Organization to start to collect and disseminate this data. And that is just starting. And it's a terrific initiative, and it's taken a long time, but we see how important that data is. At the moment, we still have incredibly conflicting data. For example, the way organizations collect data tend to be driven by the methodologies that are available. So, for example, in the humanitarian outcomes report that came out this week, it reports there were something like 20 attacks on health workers in Syria, whereas Physicians for Human Rights and the WHO reported somewhere between 75 and 110. Well, that's not because anybody did a bad job, but the methodologies have not been consistent. And unless you have a really robust effort to get out to the field to collect the data, we are not going to know. So we're still at the early stages, and we can only be encouraged and encouraged by and support the WHO efforts.
Great, thank you, Len. Len, who is that? I have a really interesting question online here that I'd like to read out to everybody, and it's directed at Grace. So Grace, listen up. It's from somebody called Sonsiama Carbo, I don't know if she's a relation, in Mozambique, who would like to ask, the work by Grace and her team in Sierra Leone was so risky that it affected their nuclei families as members of stigmatized burial teams. Should there be a policy in place to handle such issues after the crisis is over? Grace, unmute.
Sorry. Thank you, Sonsiama Cargo, for that question. Unfortunately, I'm not aware of any policy in place for that. But yes, it did affect our families, and it did stigmatize, as I mentioned, not only us, but also our families, that they are kids of a burial team worker or the husband or wife, kind of. And so it was really challenging. Some could not take it, they actually left.
Do you think such...
So I think it's something also it's something that we should learn from, a lesson learned kind of for the future, that this should be put in place. How do we handle those families? How do we work with them? Yeah, it is tough.
And whose responsibility would that be, Grace, in your opinion?
In my opinion, it will be the responsibility of both government and partners, because government takes the responsibility, and the partners also, like NGOs who are working in that area, to like collaborate with government and address that.
Okay, great, thank you. And I think now we have Marwa on the telephone, and that's who was dialing in. Marwa, can you hear us?
Yeah, I can hear clearly. Thank you.
Oh, great. We've been waiting to hear from you this whole hour, and finally we can hear you more clearly. Why don't you go back to Marcus's question about patient safety and answer that? And then, you were also telling a really interesting story before about your ER experience. If you might want to recount that as well, because I don't think that came through.
So yes, about the health worker and patient safety and the challenges as I heard the question. So let me talk in general about the health workers safety and how their life look like. So the health workers have been faced a lot of challenges since the beginning of the war, like any other Yemeni worker. So no salaries in public hospitals have been paid since 10 months ago. A lot of health facilities have been destroyed and cannot help the patient. The deterioration of the economic situation and lacking of jobs mean they are struggling to live and afford food. The staff are very dedicated, and despite the destroyed infrastructure and the lack of fuels and road blocks by checkpoints, they face all these challenges every day and continue to turn up to the work. Another challenge is when armed people enter the health facility, demand treatment, and to retain the staff. It is not easy work. In personnel, at the beginning of the war, I have been forced to leave my home for security reasons and travel with my family to another safer city, which is in the south of the country. But my family moved again to the capital because the war started in the city that we were in. What was difficult for me is that I chose to live alone in the south because I started to work with MSF in that city. It was a hard decision. My whole family weren't convinced and not happy with that. And that was one of the biggest challenges that I have ever faced. Living in very conservative society, treating male patients, working with male doctors and nurses, working near to the front line under active fighting and or airstrikes were the most challenges that I have faced.
Great, thank you. Then would you agree with Grace and the question that we had from Mozambique that psychosocial support also for families is really important in addition to health workers themselves and indeed their patients?
You mean for families or for the health workers?
Well, you were just recounting that story about your own family, and I wonder if there is support also required for families who are associated with frontline health workers and all the stigmas that entails.
Yeah, I think psychosocial support is very important for everyone, especially for the health worker, for families, because what we have seen since the beginning of the war is not easy, and it's not an easy thing. So I would like to see some such activities, especially in Yemen. For me, in personal, I have lost around 13 of my cousins in one day. And I keep working every day to help my pupils. So it's not an easy thing, yeah.
Great. Thank you. Oh, I think we have another online question. Hold on just one second. Yeah, no, I think we're okay with this question. I don't know, Marwa, we just had a question from MSF Yemen, so your own organization, asking if you could retell your story about working in the hospital and responding to 30 people, but then held at gunpoint.
Yeah. So I was working in Asalam Hospital, which is one of the hospitals supported by MSF in the south. I remembered in August 2015, I was in my morning shift in the emergency room in this hospital that I mentioned before. I remember that we heard clashes, and soon we started to receive the wounded. I still remember that when that day we received more than 30 wounded. We usually receive wounded from just one side in that health center, but in that day we were receiving wounded from both sides. We were overwhelmed, and we had to go to the wounded on the ground in the corridor and in the waiting room because we didn't have enough beds. And we were jumping between patients trying to help them. Suddenly, the armed people came in and pointing their guns in our faces and asked us to stop helping their wounded enemy and to leave the hospital. It was a terrible day, but as I mentioned that our project coordinator contacted with the community leader and urgently he intervened and took the gunman out of the health center. It was a terrible day that I wouldn't forget ever.
Okay, thanks very much, Marwa, for telling us about that. Were there any other questions, both from here in London or from our online audience for our panel? I see one here in London, two here, and three here in London. Yes, one more round of questions before we close. Go ahead.
Hi, my name's Hannah. I work at ODI. I worked on a project that was looking at development finance for mental health and psychosocial support, and I just wondered whether financing was a problem in this area, particularly because it tends to get eroded in kind of humanitarian situations. It's never sort of ring-fenced, and I just wondered if you could respond to that.
Great, thank you. Maybe we'll take some questions from over here.
Hi, my name's Marin. I'd like to ask Grace a question. Grace, as a female health worker, how do you feel that your experience in the field, especially dealing with the Ebola crisis, differed from your male counterparts?
Great, thank you. And one more over here.
Thank you. We've heard a little bit about this. Thank you so much for a really fascinating discussion. I work in communications, and I've just spent the morning poring over copy around how we better prevent crises. And my question was, we've had a lot about better data, about information, about sort of flows of communication. Whether the panel, so this is a question for everybody, had anything else they would want to say on how we can better forecast risks posed to healthcare workers and prepare for them before crises hit. So whether that's conflict or pandemics or disasters, how can we better prepare for these and work with healthcare workers before disasters hit?
Great, thanks very much. Maybe what I'll do is take everybody on the panel, and if you could respond to those three questions or any of one of those that you'd like to. We had one question on financing for psychosocial support and whether it's adequate or it's being eroded. We had a question particularly for Grace on being a female health worker and how that differs from her male counterparts. And then a question for the panel on prevention and would data collection help with better forecasting and how? Maybe I'll start with Grace since you have a question addressed directly to you.
Thank you very much. Yes, it was different somehow. On the team, males and females, they do the same thing. They carry out the same jobs. You carry bodies, you bury. But the difference is that for some of the male counterparts, they have been part of burials before they joined the burial teams, because from where we're coming from, the male do the burials. And now being a woman, being in the burial team and actually conducting the burial, it was different to some extent because it's a new experience, a new area, actually having to did directly with the body and then taking it to the cemetery and actually burying. So that was a different catch. It's like the cultural aspect of it. It took time to get over that and adjust, but every other thing was the same. Women were not given preferential treatment. They did everything together. And also the psychological aspect of it, not being used to that, but you have to do that. But after a while, you know, we are human beings. As you do things, you get used to it, and then, yeah, that was it.
Great, thank you, Grace. Marwa, is there anything you'd like to add on being a female health worker and how that's impacted on you as opposed to your male counterparts in a place like Yemen?
Yeah, as a female doctor, so I think, you know, as Yemen is a very conservative, you know, culture. So, and it's also different from city to city and from governors to governors. So when especially after the war, the living condition, and especially it was very difficult. And also working with with MSF and moving from project to project, it was very hard. And I think as a conservative, as Yemen is a conservative, you know, culture and community. Being a female doctor, working with MSF, traveling from project to project, without to have, you know, being accompanied by a male family member, it was really hard to me. And treating male patients, male wounded patients, it was a challenge for me as a female doctor.
Great, thank you. Marwa, maybe just one other question. Did you feel particularly at risk, apart from the cultural differences, as being a female worker?
About the cultural differences?
Now, apart from those, the ones you've described, did you feel particularly at risk or targeted because you were a woman? You are a woman.
Yeah, for sure. Yeah, as I told you, not in whole Yemen, but in special areas and special cities, which is very, they're very conservative. Yeah, it's very difficult for a female doctor to work in such area. Yeah.
Okay, thank you. And so we had also two questions, one on financing and one on data and its role in prevention and forecasting. I don't know, Lee, let's come back to London for a minute. Would you like to take any or both of those?
Okay, so on the question of better forecasting risks to healthcare workers, which is a really good question, I think. So I could give a management perspective on things like more robust approaches to acceptance and legitimacy and security and personal safety and training. And of course, all of those things are important and valid. But in my organisation, the reality is if you are a volunteer healthcare worker today with Doctors of the World Greece, you're providing healthcare to vulnerable, destitute migrants, there is some likelihood that your name, your photograph, your identity will be published by a far-right extremist group on a far-right extremist website, and every day that you travel to the polyclinic in some part of Athens, you run the very real risk of being physically attacked by going about the business of providing healthcare. So perhaps it's a question of how much we can tolerate risk in the real world. On the question of financing for psychosocial support, so psychosocial support is made available to everyone in my organisation who might want to or need to avail themselves of that. We try not to assume that that's the kind of support that all people everywhere need or want. Nonetheless, it's made available. Of course, one question will always come back to, is it something donors will pay for? But nonetheless, as a matter of principle, we try to deliver a good care for the caregivers program, but it's you illuminate a real challenge. So it's partly a question of mainstreaming.
Thank you. Len, would you like to address either or both of those questions?
On the psychosocial support, I think donors could do a much better job when they are supporting health programs, the humanitarian providers, to make sure that that is an element of the financing. So it shouldn't be up to Lee and other MSF and other organizations to find the resources to do that from their general funding. So I think that is something for donors to look very closely at their programs, and there could be a lot of progress in providing that support if the donors took a close look at it. On the future risk, as we know, that in all aspects of crises, prediction of risk is extremely difficult. There's been a lot of work done. In this area, I think it's dependent on what we've talked about before today. We need much better quality data to understand the present, and once we understand the present, we'll be much better off in analyzing trends and being able to do a somewhat better job of prediction of the kinds of issues that will arise.
Great, thank you. And thanks to everybody, both our panel and of those of you here in the room and online who have been active participants in all of this. I mean, I think, from my perspective, this is exactly what World Humanitarian Day should be about, a discussion about the possibility, the good work and the possibility and the positive aspects of aid work, as well as illuminating all of those challenges and commemorating those that have really put their lives at risk. And I think we've really done that with some very rich and real frontline stories, as well as some real guidance as to what we can do at various levels and through various types of organizations as we work through these challenges. So thanks very much to everybody. I very much enjoyed this discussion. I hope all of you did too. So the video kind of recording of this will be available online tomorrow. So if you want to check back with anything that anyone said, you can do that after tomorrow. There should be coffee and tea out in the hallway for you to mingle and mix after this discussion. And I'd also like to invite you to the World Humanitarian Day Memorial, which is taking place starting at 5 o'clock or 4:30, I think, this afternoon. At Westminster Abbey. There will be a sort of an evensong service at Westminster Abbey commemorating humanitarian workers starting at 4:30, and then a wreath-laying ceremony at the Memorial for Innocent Victims of Oppression, Violence, and War just outside the Abbey. If you would like to attend that, we do have to give you a ticket. I have a stack of them here, so just approach me afterwards and I will hand you a ticket. If you're listening online and would like to attend, please see a gentleman called John Nesbitt, who's wearing a maroon tie, who will be at the door of Westminster Abbey, and he will also hand you a ticket because you will need a ticket to get in. So I invite you to join me and other humanitarians in that celebration and commemoration. It's always a really lovely event. Thanks to everybody, and enjoy the rest of your day, and happy World Humanitarian Day. Thanks very much.